Good evening, I'm psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, you may call me here in the Fort Wayne area by dialing 969-2720, or if you're calling any place coast to coast, you may dial toll-free at 866-969-2720. Now on a fairly regular basis, we are broadcasting every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's mattersofthemind at WFWA.org. And I'll start tonight's program with an email I recently received. It reads, "Dear Dr. Fawver, sometimes I get suddenly afraid and I'm stuck with fear, but nothing is happening to cause it. Is this stress or my subconscious?" Could be either, quite frankly. I mean, when you feel like you're overly stressed, and that simply means you're having difficulty coping with your current life circumstances, you can sometimes get paralyzed. And when you're paralyzed with fear, what's happening is your anxiety volume control over here in the front part of your brain on the temporal lobe, that will sometimes cause your thinking part of the brain in the front to shut down. And basically it's hijacking the front part of your brain, which is the judgment, thinking, and doing part of the brain. And if you get overly stressed out, you can kind of freeze up and get stressed out in that regard. On the other hand, is it your subconscious? Sometimes if you get in a situation that was previously extremely traumatic, talking to people or people who remind you of others, that will sometimes cause you to have a lot of anxiety. And you might wonder, why am I thinking like this? So that's the whole concept of therapy, to try to help you understand situations where you might have difficulty dealing with certain types of interactions and conversations, and you might try to relate, okay, why am I having difficulty with this interaction or conversation? How does it relate to stuff that's happened to me in the past? And thereby you can overcome the fear and concern of what's happening in the present. Thanks for your email. Let's go to our first caller. Hello, George. Welcome to Matters of Mind. George, you wondered if a vitamin deficiency can cause mental health issues, and if so, what vitamins would I recommend? George, the two vitamins that come to my mind right off the bat from a deficiency standpoint can be vitamin D, D as in dog, and B12. So vitamin D deficiency can be seen especially in northern latitudes where there's less sunlight. Vitamin D is manufactured in the skin. It's actually a hormone that goes to the brain, and it can help with mood, depression. Low vitamin D levels actually have been associated with higher likelihoods of psychosis with adolescent people in Denmark, where they've done studies on vitamin D. So vitamin D deficiency, where it's low, under 55 typically is where they would measure that. But if it's low, it can give you a higher risk of depression. Some people will have more trouble with concentration. It was interesting that with COVID-19 infections, it was thought that vitamin D was actually a risk factor if it was low. It was a risk factor for acquiring a COVID infection. So it was important for people to get their vitamin D levels up, because not only can it help you from a mood and concentration standpoint, but it might actually decrease the likelihood of infection. So vitamin D would be the first thing. How do you acquire vitamin D? Well, if you got it in the sunlight for about 20 minutes every day and got adequate sun on your skin, that's going to help you with vitamin D manufacturing in your skin. But an easier way to do it, and possibly even a safer way to do it, is simply taking a vitamin D supplement on a day-to-day basis. 2,000 units is considered to be frequently safe. Some clinicians will actually prescribe 5,000 units every day, and sometimes you'll hear about a big dose of 50,000 units once a week for a few weeks, and that's to get your vitamin D level up quickly. But as a psychiatrist, I will indeed recommend people to take vitamin D levels, especially in the wintertime when it gets darker and they're having less exposure to the sun. We can do vitamin D blood levels, easy to do, but they're often no longer covered by insurance. So they would be something that people would often pay out of pocket. So B12 is another type of vitamin. If it's low, it can cause you trouble with concentration, depression. You'll notice that you can have numbing and tingling in your hands and feet, and sometimes even paralysis for that matter. But you'll notice that it's a neurological type of phenomenon with low vitamin B12 levels. Now, the low vitamin B12 can be caused by getting older, those of us over 65 years of age. We have less of an ability to transport vitamin D or vitamin B12 from our stomachs to our small intestine. Now, vitamin B12 gets transported like a bus from your stomach to small intestine by something called intrinsic factor. It comes from parietal cells in your stomach. And it's thought as we get older, we have fewer parietal cells in our stomachs, and that gives you less ability for the intrinsic factor, which is the bus, to carry the vitamin B12 to the small intestine where it gets absorbed. Because of that, older adults are more prone to having low vitamin B12 levels, and that's why it's important for us to get checked out for vitamin B12 levels periodically. Secondly, a medication, for instance, like metformin, commonly used for a lot of people with prediabetes or type 2 diabetes. Metformin is a medication that's very, very effective in decreasing insulin production and decreasing blood glucoses for a lot of people, but it can give you a slight decrease in vitamin B12 level over the course of time because it decreases the absorption of vitamin B12. So metformin as a medication sometimes will warrant getting a vitamin B12 level yearly if we have somebody on that particular medication. So medications sometimes can contribute to low vitamin B12 levels. You can have low vitamin B12 levels as you get older, or maybe you've had a bariatric surgery where they cut out part of your stomach. In those cases, we always want to make sure the vitamin B12 level is adequate because that will give you a greater likelihood for depression itself. Now, would I recommend any multivitamins on a regular basis for people? I think it depends on the circumstances. I frequently recommend vitamin D for people, especially in the wintertime, but I don't so much anymore recommend vitamin B complex for everybody. Vitamin B complex is where you get vitamin B12, but also B6, B1, which is thiamine, B2, which is riboflavin. All these different B vitamins are in there, and they're okay, but I don't really see good evidence that a vitamin B12 supplementation in the absence of a vitamin B12 deficiency would be that helpful. And the same with the other B vitamin with supplementation. I mean, your urine will be a nice, pretty gold color from the riboflavin, which is vitamin B2, but otherwise you're not going to get a lot of benefit by taking excessive amounts of B vitamins in general if you don't have distinctive deficiencies in them. There is a particular kind of folic acid. We need this particular enzyme in our systems, MTHFR, methylene transferase tetrahydrofolate, and it's an enzyme that breaks down folic acid. Folic acid is vitamin B9. Folic acid is important for our ability to manufacture serotonin, norepinephrine, and dopamine, which are important chemicals for our mood and concentration and anxiety. If you don't have adequate enzyme MTHFR, which about 1 out of 3 of us don't, you will not be able to break down folic acid to L-methylfolate. And for those people, it's recommended that they take L-methylfolate. That's what's happening with a lot of women. When they are pregnant, they're often now not given just folic acid, they're given L-methylfolate as the final breakdown product. But genetically, some people are more at risk than others in terms of having a deficiency on MTHFR. There's 2 different types of it. There's 1298 and there's 677, and these 2 different types of enzymes will break down folic acid to different degrees, and that's what genetic testing will often tell us, who needs L-methylfolate and who could get by on regular folic acid. But if you don't have the adequate breakdown of folic acid to L-methylfolate, you can have a deficiency in serotonin, norepinephrine, and dopamine, and that can give you a higher likelihood of anxiety and depression. So the vitamins that are most likely to be contributing to depression and concentration difficulties will often be vitamin D, B12, and a deficiency in MTHFR, which breaks down folic acid, which is vitamin B9, to L-methylfolate, its final byproduct. Thanks for your call. Let's go to our next caller. Hello, Laura. Welcome to Mayor's the Mind. Laura, you had asked, could I explain body dysmorphic disorder and are there signs that are different in men and women? Body dysmorphic disorder is where people are often perfectionists and they will see a particular part of their body that just doesn't look right. Often it's a facial malformation in their minds. Other people will say, I don't see anything that unusual about that particular part of your body or your face. And these people will be extremely preoccupied. Often they will go to plastic surgeons to get corrections. Often they'll try to hide the particular malformation that they perceive with cosmetics. Men will often have more difficulty with body size, that more they don't think they're muscular enough, and men will get very preoccupied with that, whereas women will have more difficulty with breast size and body weight in general. So body dysmorphic disorder is where you have an over preoccupation of a perception that a particular part of your body doesn't seem right. It often is associated with perfectionism, obsessive compulsive disorder. It's thought to be kind of a type of OCD, where some people have a tendency toward having OCD features, where they're obsessive, where they're having unusual, unnatural thoughts about something, and then they have compulsions where they have to do something over and over again to try to relieve themselves of that particular obsession itself. Many people with body dysmorphic disorder will have other family members who have similar symptoms, and it's thought that, to some degree there might be a biological component to it, but on the other hand, some of the behavior is learned. But body dysmorphic disorder is where you have an sensitivity to a particular part of your body that just doesn't look right to you. Laura, thanks for your call. Let's go to our next caller. Hello, Cindy. Welcome to Matters of the Mind. Cindy, you want to know the difference between a psychologist, psychiatrist, and a therapist, and why would somebody need all three for treatment? It's not unusual, Cindy, that people might have at least a psychiatrist or maybe a psychiatric nurse practitioner or a family nurse practitioner, not uncommonly, somebody prescribing the medication, because number one, you want to get the biological aspect of the brain on track, all right? So the idea of having a psychiatrist, a psychiatric nurse practitioner, a family nurse practitioner, somebody who's prescribing the medication itself will be to allow the brain to biologically function normally. Now, where's a therapist kind of fit in? A therapist will help coach you to go the particular direction you need to go. A psychologist in today's day might do some therapy, but a psychologist does a really nice job with diagnosing and determining treatment plans that need to be completed. So psychologists are PhDs. They've done a doctorate level training where they started out maybe with a psychology degree, they got a master's degree, then they got a PhD or a PsyD. Those are psychologists. A psychiatrist went to medical school, and after medical school, a psychiatrist goes to psychiatric specialty training for an additional 4 years. And then a psychiatrist gets an MD. In 2024, psychiatrists are primarily involved in psychopharmacology, which is a fancy term for meaning that they're specializing in medications that will change for the better brain chemistry. So if you think about an analogy here, Cindy, here's kind of the way it works out. If you think about a psychiatrist treating, using an automobile analogy, the psychiatrist is actually treating the mechanics of the automobile itself. So the psychiatrist is helping with the brakes, the accelerator, making sure that the filters are all working properly. The psychiatrist is working more with the mechanical aspects of the automobile itself. The therapist, on the other hand, is helping you with more navigation and steering where you need to go with your overall goals. So when you get into your automobile, you have a goal to get somewhere. Often that's what a therapist will do. Now, a psychiatrist or somebody who's prescribing the medication, like a nurse practitioner, will be more involved in helping you with the mechanical aspect of getting to those goals, but a therapist will help you get to those goals. Now, what will a psychologist do? A psychologist is kind of like the car mechanic who will say, I think this or that's wrong and this needs help, and a psychologist will often make recommendations one way or another. But many times, not uncommonly, a psychologist will also help you to navigate those particular goals. Why would somebody need all three? A psychologist would often be there for the purpose of helping diagnose an underlying condition, looking at the whole picture in general. A psychiatrist would be somebody who would prescribe the medication, also making diagnoses, because you really can't prescribe medication unless you have a clear understanding of the diagnosis. So using an analogy in a different way, if you have chest pain, the chest pain could be coming from a heart condition, a lung condition, a stomach condition. Chest pain can be caused by a lot of different things. And based on the diagnosis of what's causing the chest pain, you're going to have different treatments. That's what a psychiatrist will do when you say to a psychiatrist, I have trouble with my memory, or I have trouble with my mood. You have to determine, why a person's having trouble with their memory or their mood from a biological standpoint to determine what medication might be appropriate. And then, of course, the therapist is somebody who's going to be helping navigate you to the goal and where you want to go. So they'll often give you specific tips. They'll give you life circumstances, ideas in terms of what direction you can go in your counseling. So a therapist is going to do more counseling and psychotherapy for a lot of people. So there can be a reason why people would use all three, a psychologist, a psychiatrist, and a therapist. But usually it's a medication treatment in combination with some kind of therapy or psychotherapy. And the therapy and psychotherapy can be done by a psychologist and or a therapist. Cindy, thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, I have a friend who seems to check out or dissociate when confronted with conflict. What is happening that they cannot stay present? If somebody's checking out or dissociating with conflict, not uncommonly that particular person has endured, not that it's diagnostic and definitive, but many times that person has endured some kind of trauma in the past, all right? So if you dissociate or you check out very readily with a lot of conflict, it often means that you've endured some kind of traumatic experiences in the past. It could have been emotional trauma, it could have been sexual, physical trauma, some kind of trauma in the past that caused your brain to kind of learn to check out as a defense mechanism when you're under stress. So let's say, classically it occurs when you're a child before the age of 8 years of age, you've had difficulty with emotional, sexual, physical abuse, you've had abandonment, something happened during those early childhood years. Well, you get the little anxiety center, the amygdala up here, getting all fired up. The amygdala is right beside the memory center of the brain, and sometimes to endure all that trauma as a child, the way you get over it is by just tuning out, and your brain checks out in such a way that your brain can't remember that it all happened. So many people who have endured traumatic experiences, whether in childhood or later in adult life, forget some of the details of the traumatic experiences because their brain was so fired up with fear and anxiety, even anger for that matter, that it just caused the memory center to just check out. Later on, when you endure any kind of stress, sometimes your brain can biologically go back to that mode of checking out. So let's say you have a boss who raises his or her voice toward you. That can cause you all of a sudden to have kind of a freezing episode or a episode where you check out or dissociate, where you basically don't realize what's happening around you. So the brain can sometimes use those old defense mechanisms, not in a good way necessarily, but that's how you learn to deal with stress. You check out and you kind of forget what happened over the past few minutes. So it's called dissociation. Some people have what's called depersonalization. Some people have what's called derealization. Depersonalization is where you can't remember who you are. Derealization is where you can't remember what's happening around you in reality. So you kind of tune out from that very briefly. And it can occur under times of stress. And the whole treatment approach with that would be to help you deal with the stress itself and improve your coping mechanisms so you don't have to fall back on dissociation as a means of trying to help you with the stress itself. There is a particular kind of dissociation called dissociative identity disorder. DID, dissociative identity disorder, used to be called multiple personality disorder, but it's a real phenomenon. People who, and typically will be women, who've been traumatized in their younger years will go to one personality or another, and some people can have dramatically several different personalities. There was a book decades ago by the name of Sybil that described this whole phenomenon. It's a real phenomenon, but it's where as a coping mechanism, you go to one personality or another, and you dissociate during that time where you tune out, and it's a way of getting through stress. And if you learn it as an early child, you often end up doing those kind of techniques and tactics later on as an adult when you're trying to deal with stress. Thanks for your call. Let's go to our next caller. Hello, Daniel. Welcome to Matters of the Mind. Dan, you had mentioned that your wife has recently been diagnosed with a mental health disorder. You have 2 young children. What age is appropriate to explain that is what's happening with your kids? Daniel, it depends on how old your children might be right now and how long they've been dealing with the mental illness of your wife. In other words, if your wife is their mother, they've been around your mother for a period of time, they realize there's something different about her. They might realize that she can tolerate so many different stresses. Children, after the age of 8 years old, have a pretty good understanding of what's happening in the household, and even younger than that in some cases. So it depends on what they've noticed about their mom. where if their mom gets readily upset about certain things, often the children will react accordingly. You don't have to go into the neurobiology or the diagnosis or the treatment of your wife with the children necessarily, but as they get older, you can help them understand that her having difficulties with mood or anxiety disturbances, for instance, can be not uncommon in such a way that it's a biological medical condition, like with your heart or your kidneys or any other kind of medical type of condition. So I think it all depends on how much they are aware of what's going on and how they've reacted to it. Daniel, thanks for your call. Let's go to the next email question. Our next email question reads, Dear Dr. Fawver, how do I know if I need something or if I'm addicted to it? People often ask about that with coffee. They wonder if they have a coffee addiction, for instance, because they'll notice when they awaken in the morning, they feel the need to have some caffeine in their system to be able to have more mental clarity and to awaken. So if you're addicted to something I learned decades ago in my early training was that when you're addicted to something, number one, you lie about it, and number two, you hide it. So if you're lying about your coffee consumption or you're hiding it from other people, that means you're addicted to it. Now, addiction by nature means you can have physical types of addiction where you need to have it and you need to have higher and higher amounts of it. We call that tachyphylaxis, but you need to have higher doses to get the same effect. That's an addiction. Number two, you have an addiction if you withdraw from something because you need those higher amounts, and when you stop it, you have a lot of physical type of symptoms. That can be suggestive of an addiction. But when you have an addiction, you're using something inappropriately at higher amounts than you really should, and you're lying about it to other people. Other people are noticing it's a problem for you, and you're hiding it from them. So that's where you cross the line from needing something to an addiction. Now, some people will say, well, gee, I don't want to take an antidepressant medication because I don't want to get addicted to it. Well, people don't get addicted to antidepressant medications because what antidepressant medications do is they replace something in your brain that you will need. So getting addicted to an antidepressant medication would be like getting addicted to your eyeglasses. If you wear eyeglasses to correct your vision, it means you need the eyeglasses to correct your vision. You're not addicted to your eyeglasses. So the same thing can be true with antidepressant medications. You can need the antidepressant medications somewhat like a person with diabetes will need medications to help them with normalizing your blood sugars. It doesn't mean you're addicted to your diabetes medication. You need them just to correct the underlying problem itself. Thanks for your call. Let's go to the next caller. Hello, Shannon. Welcome to Matters of the Mind. Shannon, you mentioned that you're on Zyprexa, also known as olanzapine, and a side effect is having a stroke. My father just recently had a stroke. Should you be concerned about having a stroke with Zyprexa since you have a family history of strokes? That's not the way it usually works, Shannon. I'll tell you how the stroke risk with Zyprexa occurred in the early 2000s. We're talking about 25 years ago. They did studies using Zyprexa, also known as olanzapine, and Risperdal, also known as risperidone, on people who had trouble with dementia. And with the dementia, they had agitation, and some of them had difficulty with reality, maintaining reality. So they tried low doses of these antipsychotic medications on elderly people who were having some agitation. Well, some of the elderly people had a higher risk of strokes, and in some cases, they had trouble with respiratory depression. But when you look at the data involved in those people, they were already at a higher risk for stroke anyway, but the people who had strokes versus people who didn't have strokes were more likely to have Ativan, Valium, Klonopin, or some kind of benzodiazepine medication added to the Zyprexa itself. So would Zyprexa, if you don't have dementia, if you don't have psychosis-related dementia, put you at higher risk for stroke? No, it doesn't look like it would. So if you're not being treated as an elderly person, that means you're not over 65 years of age and you're not being treated for dementia with psychosis-related dementia, those are the risk factors. It's elderly people over 65 years of age having dementia who are being treated for agitation at that age group. So those are the people that are higher risk for a stroke. If you're younger than 65 especially, despite having a family history of stroke, no, Zyprexa wouldn't give you that higher risk for a stroke necessarily. And again, emphasizing that the people who had strokes in those studies were more likely on additional medications such as Ativan, Valium, Klonopin. These are the so-called benzodiazepine medications that in today's world, 25 years later, we wouldn't give those medications with Zyprexa or Risperdal or Risperidone anyway. Shannon, thanks for your call. Let's go to our last email question. Our last email question reads, Dear Dr. Fawver, are coffee naps legitimate? They don't seem real. Actually, coffee naps can be very legitimate. Coffee basically will give you caffeine content. When you're tired and you drink a cup of coffee, it takes about 20 minutes for that coffee to kick in. Caffeine in the coffee will go to this little adenosine receptor. Adenosine is kind of like fumes, from exhaust fumes in a car. So as you drive your car, you have exhaust fumes. Well, our brains will do the same thing because adenosine will be like the exhaust fumes that make us tired as the day goes on. If you have a nap, number one, that will tend to decrease the adenosine level in your brain. But secondly, the caffeine in coffee will go to the adenosine receptors and knock off any adenosine that's there. So the nap will help and the coffee will help over the course of 20 minutes upon it getting absorbed. So a coffee nap is basically where you drink a cup of coffee, take about a 20-minute nap. When you wake up, you're refreshed. So it is legitimate. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues, you may write me via email at mattersofthemind, all one word, at WFWA.org. God willing and PBS willing, I'll be back again next week. Thanks for watching. Have a good evening. Good night.
The preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.